Hi Heather, Belinda Murphy here. Today I'm doing my presentation on the benefits of breastfeeding. Breastfeeding is a choice that every new mother must make for herself and her baby. And, you know, it's a decision that sometimes has to be made for you because sometimes you can't breastfeed. If you can't breastfeed, I think it's very important that you don't pressure people to make them feel like they're making a horrible mistake by not breastfeeding. It's each and every individual's choice, so, it should be the choice that is best suited for them. Breast milk provides the ideal nutrition for infants. It has a perfect mix of vitamins, protein, and fats that your baby needs to grow. And by the baby getting all of that from you, it helps to lower your baby's risk of having asthma or allergies. Being breastfed for the first 6 months seems like the babies have fewer ear infections, fewer respiratory illnesses, and bouts of diarrhea, which is always a positive. As for the moms, when you breastfeed, burns calories. Those calories that are burning are great because we all put on weight usually when we're pregnant. So that makes it easier to get rid of that pregnancy weight. And it also releases oxytocin, which helps your uterus return to its pre-pregnancy size. Again, that helps shrink everything back into place, so that's a bonus as well. It seems to reduce the risk of breast and ovarian cancer, which seems to be a very high rate these days of people getting those types of cancer, and at a younger age. As for breastfeeding, it strengthens your bond with your baby, because when you spend the time with your baby, you get to know each other a little bit better. You still get to have a bond with the baby when you're feeding them a bottle, because even if you can't breastfeed, you can still pump and bottle feed, but you do get that time with your baby. And that's something you really want to do, is bond with your baby right off the hop, because they're with you for life. Choosing to breastfeed is a very good decision financially, because formula is very expensive. I know that from personal experience. I think it was $50 for a case, and I used to only get 20-something bottles out of it. So I was kind of the person who I chose to breastfeed, and after, I think it was 2.5 months, the pain got so bad in doing it that I couldn't do it anymore. I tried everything. And I felt guilty, and I know a lot of moms feel guilty about not breastfeeding. And you know what? My baby is now 4, and he's A-okay. So, you get the best of both worlds. I did it as long as I could, and then I went to formula, and it was very expensive. And, a lot of people don't have that kind of money to spend on formula. When you go on maternity leave and your pay gets cut to pretty much half, that's a big income that you're losing out on while you're staying home to take care of the little one. So it can be difficult to breastfeed. If you can do it, though, totally do it. I would, anyway. I tried. There's also lots of helpful resources out there, like doctors, midwives, family members that have experience with that. And there's online groups too. You can visit the Public Health Agency of Canada website. They always have lots of information about breastfeeding, and places where you can go to get help, or phone numbers. So that's a big bonus. And when you first have your baby, you want to have skin-to-skin contact. Skin-to-skin contact is, they come right out of the womb, clean them off, put them on your chest, or, if you've had a C-section, the dad or whatever family member is with you can do the skin-to-skin contact. It's a bonding thing, and it really helps to stimulate milk production and triggers the baby's feeding reflexes. So that's important. And usually they say babies start feeding within like the first hour of birth. So, you want to get them warm spot, nice and cozy, and look for those feeding reflexes. There's different signs that, tell you if your baby's ready to breastfeed or not. One is rooting, licking their lips, putting their hands in their mouth, and a huge one, which I'm sure everybody in this world knows about, is crying. Babies cry when they're hungry, so, just try them out and keep trying. When you breastfeed, you want to be comfortable, because sometimes it can take a while depending on how well they latch on and how much milk you've produced, and there's different, so you want to be comfortable. And when you're breastfeeding, you want to make sure to bring the baby to your breast and not your breast to the baby, because it can be difficult. If you're not comfortable, you sit there and you're just sitting there uncomfortable. You want to be comfortable. When you're comfortable, your baby's more comfortable, and that makes the world a difference. That's, your babies can kind of sense that stress from you. So if they feel kind of stressed out, they're not going to eat that well, and we want them to eat. So when you're breastfeeding, there's just a couple tips that I have here about breastfeeding. You want your baby's mouth, which I should say their lips, to close over the areola and the nipple to form a seal. If the seal is a good seal, you'll notice that their lips are kind of curled over it, and that usually gives them good suction. You can try putting 4 fingers under your breast with kind of a thumb to get it into their mouth, and you could also just lactate a little bit of milk there so that they know what they're doing, what they're going for. They'll get a taste for the milk, and then they'll usually latch on. So if you get a good latch, fingers crossed, it all works out and the baby can get the milk. When the baby comes off the breast or is no longer sucking actively, it might be time to burp them. And after you do that, you just switch to the other breast. That's usually how you do it. You want to keep the milk production going equal on both sides, and you don't want to let your glands get too full, because I know from previous experience it's very painful when there's a whole lot of milk going on in there. If you need to take your baby off the breast, all you can do is gently place a finger in the corner of their mouth, and that will break their suction, because if you don't, you could injure your nipple just from the pull of the suction. So you want to make sure you break that suction before you pull them away, because you don't want to hurt yourself. If you're having trouble latching, a lot of people do, there are devices available. You can get nipple shields. Nipple shields are great. I know a lot of people that have used them and they've worked wonders for them. It also helps with their soreness and such, and you can still breastfeed, but it gives you that barrier protection where, your nipple's not getting sucked the life out of it. And you can also try pumping. There's lots of pumps available. You can get cheap ones right up to crazy expensive ones. They all work. It just kind of depends on what you're looking for. If you're pumping a lot of milk, if you're pumping full time and just feeding them with bottles, which a lot of people do, that's a great way for mothers on the go to breastfeed. You can freeze your breast milk, and family members can still feed them, and baby's still getting the breast milk, so it's the best of both worlds. So how to know if your baby's getting enough milk? Well, it's pretty simple. If the baby's gaining weight, the baby's getting enough milk. 6 or more wet diapers a day will get you enough, there's enough going in because there's enough coming out. Input and output. Huge in the nursing world. And it takes a few weeks to get the hang of it, but just hang in there. You'll get it. The more you breastfeed, the more milk you produce. And once your baby's 6 months old, you can start introducing food into their diet as well as the breast milk. Some people breastfeed up to 2 years. Some people breastfeed over 2 years. It's kind of your decision. And when you're breastfeeding, you want to give the baby vitamin D supplements because you don't have the vitamin D in your milk, and vitamin D is an important supplement for them to have. And my last tips are sleep when your baby sleeps. Very important because the 2 hours, waking up every 2 hours to feed them during the middle of the night is exhausting. Accept help from people that are trying to help you. Makes a difference. And ask for help if you need it. That's a huge one. I know for me, single mom, my parents, they were the best. Eat healthy and drink when you feel thirsty. You want to eat healthy because you're making that milk that goes into your baby. So what you eat, it really goes into them, and you want what's best for them. So take care of yourself too, mama. And invite visitors over only if you want to. Don't have company out. It's an exhausting time. You're getting to know your baby. You're feeling horrible. I know I did after I had a baby. You just want to lay in bed all day. So do that. Do whatever you feel like doing. Take care of that baby and yourself. And also, alcohol and other drugs can pass on into your breast milk, so you want to be very careful of what you're taking in. There's an info line for information on medications, anything you want to know that goes into your breast milk. It is 1-800-1877-327-4636, and there's also a website, which is on my PowerPoint presentation, the number as well. It's www.motherrisk.org. That's really good information. And I thank you for listening to my presentation. And you can see where I got all my information on my reference page, on my PowerPoint slides. Thank you very much, and have a great day.